The VITA VM Basic Layering with Base Dentine and Enamel. To achieve your goal simply, accurately, and quickly. For layering with VITA VM LC, a metal substructure is prepared with the bonding system Bond and with Opaque. Before layering, the model is insulated with VITA VM LC separator and placed onto the prepared substructure. The shade-intensive base dentine is taken up with a spatula. By applying slight pressure to the material, the consistency becomes softer. Make sure air impactions are avoided. Base dentine is applied in the desired shade. In the first step, a large portion is applied evenly to the labial surface. Now continue the buildup of the tooth form. Thanks to the good modeling properties of the composite, the use of modeling liquid is not absolutely essential. In order to accommodate the translucent enamel, reduce or model the base dentine according to the layering structure. Mamelons are formed in the upper third of the veneer to create a natural layering structure. If necessary, carry out an intermediate curing. Now, build up the palatal surface with base dentine and check the occlusion. If a wall thickness of 2 mm is exceeded during layering, a final curing must be carried out to ensure complete curing. Application may be subsequently continued. Palatal view of the completed base dentine layering and labial view. VITA VM LC enamel is applied in a thin layer to the upper third. Thanks to the homogeneous distribution of the microparticles, a natural light scattering effect and translucency are achieved in the restoration. Take up a small portion of enamel to build up the incisal area. Immediately close the syringe each time after use to prevent the material from hardening unintentionally. Bring the enamel into the correct shape while still on the mixing plate and apply to the veneer. Begin with the distal and mesial ridges. Flatten out the enamel to obtain smooth transitions. In contrast to the basic layering, the resin enamel material is applied only in the upper third. This is on account of the differing material properties of ceramic and acrylic. Beginning at the ridges, then apply enamel in the palatal area. Incisal view of the completed basic layering and labial view. Build up the shape of the tooth in the interdental area and check the marginal areas before the final curing. Carry out the final curing of the restoration in a suitable light curing unit. Finishing is carried out with fine-cut tungsten carbide burrs. Diamond instruments are not suitable in this case. After pre-polishing with a goat hair brush, polish to a high gloss with a wool or leather buffer. Incisal view of the completed basic layering with VITA VM LC and labial view. This way, a restoration with a natural appearance and light refraction and reflection resembling natural tooth enamel is achieved with only 2 layers.